And we're, all right, now for this particular chapter, pathophysiology, for medical emergencies, pathophysiology is extremely important. So you need to understand what is going to happen when the system that is being affected is not working properly. Very important. I always tell students this: if you're able to understand pathophysiology of the problem, you don't need to SWOT the signs and symptoms. You will know what the signs and symptoms will be. So pathophysiology applies fundamental knowledge of the pathophysiology of respiration and perfusion to patient assessment and management. Medicine, we covered this previously, applies fundamental knowledge to provide basic emergency care and transportation based on assessment findings for an acutely ill patient. We will look at a review of the anatomy of the cardiovascular system, signs and symptoms and management of chest pain and cardiac arrest. We'll look at the anatomy, physiology, and pathophysiology and assessment and management of acute coronary syndrome, which includes angina pectoris, which is a medical term for chest pain, and myocardial infarction, which is a medical term for a heart attack. We will look at an aortic aneurysm or dissection. We will look at thromboembolism. We'll look at heart failure and hypertensive emergencies. All right, now introduction. Excuse me. I'm back. Introduction. Cardiovascular disease has been the leading killer of Americans since the 1900s. It accounts for 1 of every 3 deaths. And this is just some statistics. EMS can help reduce deaths by, and I mean, the number of deaths might be quite high in Jamaica based on the type of EMS response that we have currently. EMS can help reduce deaths by encouraging healthy lifestyle, early access to medical care, very important, more CPR training for lay people, increased use of evolving technology in dispatch and cardiac arrest response, public access to defibrillation devices, recognizing the need for advanced life support, the use of cardiac specialty centers when they are available. All of these things are necessary, man. Now let's review the anatomy and physiology of the circulatory system. So the heart's job is to pump blood to supply the oxygen-enriched red blood cells, to supply oxygen-enriched red blood cells to tissues. It is divided into left and right sides. It has upper chambers and lower chambers. The upper chambers are the atria, and the lower chambers are the ventricles. The upper chambers are responsible for receiving blood. The lower chambers are responsible for distributing blood. The largest chamber of the heart is the ventricle, left ventricle, because it does the most work. Now, there are one-way valves within the heart to keep blood flowing in the proper direction. So you have the tricuspid valve, which is on the right side. So that's the right side. And you have the mitral or bicuspid valve on the left. And how I remember it, I say try right, by or my left. So you have valves within the heart, and you have a valve in the aorta and a valve in the pulmonary artery. The presence of these valves prevent backflow, and when they open and close, that's what you're listening to. That's what you listen for as the heartbeat, when the valves open and close. The aorta is the body's main artery, and it receives blood ejected from the left ventricle. So the largest vein in the body is the vena cava. The smallest would be the venules. And the largest artery is the aorta, and the smallest arteries are the arterioles. Now, the connection between the arterioles and venules is the capillary. So the capillary is the link between the smallest arteries and the smallest vein. It is a closed network. Now, the veins primarily carry deoxygenated blood, right? So the veins primarily carry deoxygenated blood, with the exception of the pulmonary veins. Veins carry blood towards the heart. That's the direction that veins carry blood. Because it's carrying blood towards the heart, that blood cannot go to the heart under high pressure. So veins are low pressure vessels. The veins, because they are low pressure vessels, they need valves inside of them to prevent backflow. The valves are located within the veins to prevent backflow. So that's the veins. The arteries primarily carry oxygenated blood, with the exception of the pulmonary arteries. A is for away. So the arteries carry blood away from the heart, with one exception. So there is one artery that carries blood directly to the heart muscle, the coronary artery. And that's the artery that is affected when a patient has a heart attack. Because the arteries are carrying blood away from the heart to the rest of the body, that blood needs to be under high pressure. So arteries are high pressure vessels. Because they're high pressure vessels, they don't need any valves. And that's your blood vessels. And these two diagrams are just showing the flow of blood on the right side and the left side. The right side of the heart is responsible for the movement of for receiving and distributing deoxygenated blood. The left side is responsible for receiving and distributing oxygenated blood. Now, there is an electrical system within the heart that creates a rhythmic contraction. So the heart's electrical system controls the heart rate and coordinates the atria and ventricle. The electrical impulses start at the SA node, and then they move down to the AV node, to the bundle of His, then to the left bundle branch, then to the right bundle branch, then to the Purkinje fibers. The impulse from the SA node will pass from the atria to the ventricles. Automaticity allows spontaneous contraction without a stimulus from a nerve source. So that term automaticity means that the heart can generate its own electrical impulse. It doesn't necessarily need an outside stimulus. That's a unique property to the heart. All right, now this is an important diagram. Right, so you can see where the SA node is. The SA node is what gives us a pulse rate of 60 to 100 beats per minute. So in an adult, the SA node is going to fire at 60 to 100 beats per minute. As it moves to, let me see if I can get a pointer. I don't know if you guys are going to see my pointer, but I can see it. You might not be able to, but just follow me. As the impulse moves from the SA node to the AV node, it's going to slow down. So at the SA node, it's 60 to 100 beats per minute. When it gets to the AV node, it's going to slow down to 40 to 60 beats per minute. Now, the reason why the impulse is slowing down is because the ventricle needs time to fill with blood. The impulse can't reach the ventricle and there's no blood to push out. So it slows down that blood can fill the ventricle. Now, when the impulse leaves the AV node, now let me just point this out before I go any further. The SA node is often referred to as the sinoatrial node. The AV node is also referred to as the atrioventricular node. So when the impulse leaves the AV node, it goes down to the bundle of His. At the bundle of His, it slows down more. So at that stage, it's going to be 20 to 40 beats per minute. So if it's the SA node and it's an adult, 60 to 100 beats per minute. If it's the AV node and it's an adult, 40 to 60 beats per minute. If it's a bundle of His, it's going to be 20 to 40. So keep slowing down. Now, from the bundle of His, it goes to the right bundle branch, which feeds the right side of the heart, and the left bundle branch, which feeds the left side of the heart. And at the end of these branches, there is what is referred as Purkinje fibers, which directly stimulate the cardiac cells. And that's how the current flows from the SA node to the cells. Now, point to note, if the SA node is not firing, the AV node will take over, but it's going to be a slower heart rate. If the AV node is not working properly, the bundle of His will take over, but it's going to be a slower heart rate. If the bundle of His is damaged or fails, the connection between the right side of the heart and the left side of the heart is gone. There's no connection. Now, if there is no coordinated impulse going to the right and left, then we're going to get chaos, right? And what that means is each cardiac cell on the right side is now going to try and generate their own electrical impulse. And each cardiac cell on the left will try to do the same. And we get what is called fibrillation. The ventricles start to fibrillate. What that looks like is this. So this is what ventricular fibrillation looks like. It's a chaotic rhythm. So this is what it looks like. When we get to this point, anytime we get to this point, it means that the patient can no longer generate their own electrical impulse. And when a patient, sorry, it means that the individual cells are trying to generate their impulses, but it's not strong enough to generate a pulse. So when a patient has fibrillation, there's no pulse. This is a patient in cardiac arrest. So this is where CPR with chest compressions, ventilation, and the use of an AED is going to be necessary. The AED is going to deliver current to kill the chaotic activity with the hope that the SA node or sinoatrial node will take over. So that's the electrical conduction system. I will touch on it again. Now, the autonomic nervous system controls involuntary activities. The autonomic nervous system has two parts. It has the sympathetic nervous system and the parasympathetic nervous system. The S in sympathetic nervous system means that it speeds up things. So that S means it speeds up stuff. That's what the sympathetic nervous system does. It's going to increase respiration, increase the heart rate, increase the functions of the heart. It increases things. The parasympathetic nervous system, the word para means half. S, speed. So the parasympathetic reduce the function of things. So it slows things down. It slows down the heart rate, right? Slows down brain function, slows down the respiration, slows things down. These two systems work together to maintain balance in the body. The sympathetic nervous system is the system that produces what you know as adrenaline or epinephrine. So it produces adrenaline and epinephrine or epinephrine. So if you see the term adrenaline, it's the same as epinephrine. If you see the term epinephrine, it's the same as adrenaline. The sympathetic nervous system also produces noradrenaline. Noradrenaline is the same as norepinephrine. Now, when norepinephrine comes out, it affects alpha receptors, which are found mainly in the blood vessels, and it stimulates blood vessels to constrict. That's what norepinephrine or noradrenaline does. When epinephrine or adrenaline is produced, it will affect the heart and the lungs. So it affects beta 1 receptors, one heart, beta 1. And it affects beta 2 receptors, 2 lungs. That's how I remember it. When adrenaline stimulates the lungs, it opens up the air passage. When it stimulates the heart, it increases the functions of the heart. So it increases the rate of contraction, the strength of contraction, and the speed of electrical conduction. And this is why it is valuable to a patient who is in anaphylactic shock. The sympathetic nervous system also produces endorphin. Think of the word endo mean inside. Orphan is a short version of the word morphine. So when endorphin is produced in the body, the body is producing a painkiller naturally. That's what endorphin does. It decreases pain, which you have experienced in your life, but you didn't really realize that that is what was happening. If you're physically active and you play football or any type of contact sports and you get an injury, right? It doesn't hurt that much while you're playing, right? You can still play with it because endorphin is being produced to reduce that pain sensation. But as soon as you go home and the endorphin wear off, you can barely stand or barely use that limb. The pain is significant at that point because the endorphin wear off. So that's your sympathetic nervous system. The parasympathetic, as I said, this is a system that is going to slow things down. When you go on lunch and you come back and I am going through the lecture and you start drop asleep, that's the parasympathetic system kicking in. So the parasympathetic system is redirecting blood from your brain and directing that blood to your intestines to digest the food. It is the rest and digest system. If less blood is going to your brain, then your brain function is going to slow down and you get sleepy. That's a parasympathetic. It produces acetylcholine. That is the chemical that it produces, acetylcholine. And it can slow down the heart, slow down the respiratory rate. It increases blood flow to the intestines, decrease blood flow to the brain. As I stated before, these two systems work together to maintain balance in the body. And both of these systems can have functions, can create functions within the heart. So even though the heart can generate its own electrical impulse, these two systems can also control the heart. One can speed it up, one can slow it down. Right? I did my best to make that as clear as possible. Now, the myocardium must have a continuous supply of oxygen and nutrients to pump blood. Cardiac output is increased by increasing the heart rate or stroke volume. Stroke volume is the amount of blood that is pumped out of the heart with each contraction. In the normal heart rate, increased blood is delivered to the myocardium by dilating the coronary arteries. Very important. So the coronary arteries get blood flow to the heart by dilation. So when they open up, the blood feeds the heart, and it's passive. It's not an active flow of blood because, as I stated before, the heart cannot get blood under high pressure. And the arteries that supply the heart is the coronary arteries. Make sure you remember that one, man. Remember it. Now, the coronary arteries are blood vessels that supply the blood to the heart muscle. I have the right coronary artery and the left coronary artery. The coronary arteries start at the first part of the aorta. So they actually start to branch out from the aorta. Now, when the valve inside the aorta closes, the aortic valve, when blood is pumped through the aortic valve and it closes, the backflow of blood, that passive flow of blood, fills the coronary arteries. Now, arteries supply oxygen to different parts of the body, and some of these you might very well be familiar with at this point. Right and left carotid, that's the one in the neck. It supplies the brain, subclavian, shoulder area. Brachial is the upper arm, the radial and ulnar forearm. Right iliac, pelvic region. Right and left femoral, lower extremities, specifically thigh area. Anterior and posterior tibial, and the peroneal arteries, lower extremities. Arteries and capillaries, arterioles and capillaries are smaller vessels. And remember earlier I said to you that the arterioles are the smallest arteries within the body, venules are the smallest veins, and the capillaries are the connection. So the circulatory system is a closed network. And at the level of the capillaries, only one cell can pass at a time. So the capillaries connect arterioles to venules, and the capillaries are the smallest blood vessels in the body. Venules are the smallest branches of veins. The vena cava return deoxygenated blood to the heart. That's the largest vein in the body. Now, blood, because there are three components to the circulatory system. You have the heart, which is the pump. You have the blood vessels, which is the pipes. And you have the blood, which is the fluid. So the blood consists of red blood cells or erythrocytes, which are responsible for carrying oxygen. And only 4 oxygen molecules can bind to the red blood cells. Once it has 4 oxygen molecules, it's properly oxygenated. The white blood cells or leukocytes, they are responsible for fighting infection. The red blood cells don't move on their own. White blood cells do. So white blood cells will move to wherever there is a problem in the body. Platelets are responsible for clotting. And the plasma is the fluid that transports all of these components all over the body. Now, the blood pressure is the force of the circulating blood against the arterial walls. You have the systolic pressure and you have the diastolic pressure. What you need to remember is that the systolic pressure is obtained when the left ventricle contracts. The diastolic pressure is obtained when the left ventricle relaxes. A pulse is felt when blood passes through an artery during systole, the contraction phase. Peripheral pulses is felt in the extremities, and we go for the peripheral pulses for patients who can communicate with us. Patients that are not communicating will go for central pulses, specifically carotid pulse. And these are important pulse points for you to learn. So these you definitely need to know. These are pulse points that you must know. Must. Carotid, brachial, posterior tibial, femoral, radial, dorsalis pedis. The dorsalis pedis is a tough one to locate. So practice to feel for it. What I do, when I locate that pulse, I'll use something to mark the area. So I'll either put a piece of tape or mark the area with a mark or a pen. But ideally, tape would be appropriate. Now, cardiac output is the volume of blood that passes through the heart in 1 minute. Perfusion is the constant flow of oxygenated blood to tissues. If perfusion fails, cellular and eventually patient death will occur. And that's a review of the anatomy and physiology. Okay? Now, the pathophysiology. And let me emphasize this. You must, it is absolutely important that you know the structures and you understand how they function before you start to look at abnormal function. If you don't, you're going to get confused. So pathophysiology, chest pain usually stems from ischemia, which is decreased blood flow. Ischemic heart disease involves a decreased blood flow to one or more portions of the heart. If blood flow is not restored, the tissues die. So ischemia will lead to infarction. Ischemia is a lack of blood flow to the area or decreased blood flow. If that is not corrected, it leads to infarction. The tissue in that area will die. If the infarct tissue is not treated properly, then it will become necrotic. It starts to rot. And with that said, I'm going to stop at this point. So I'm actually going to stop here. And when we come back for lunch, we will continue.